Well, welcome back to Odonto Jam. Today we have joining us endodontic specialist Dr. Aovana Timmerman. Aovana graduated with a Bachelor of Dental Science from the University of Melbourne in 2001, and after completing her fellowship with the Royal Australasian College of Dental Surgeons in 2010, she continued with her specialist training, obtaining a doctorate of clinical dentistry in endodontics. Aovana has been involved with endodontic education since 2011 and was awarded the Graduate Certificate in Clinical Teaching in 2019. Currently, Aovana is a clinical demonstrator for the Doctor of Dental Surgery Endodontic program at the University of Melbourne and examines dentists in the membership GDP program for the RACDS and Australian Dental Council. Aovana is also pursuing her PhD part-time at the University of Melbourne and has published research in both local and international peer-reviewed dental journals. Thanks, Aovana, for joining us on the show. It's really great to have you.
Thank you for inviting me.
Oh, my pleasure. Look, for some of our listeners who are tuning in at the moment, they may have seen some of your posts and your clinical tips and cases that you share on Instagram. But for those of our listeners who haven't come across you on social media or at other CPD events, would you mind just giving us a little bit of a background into your journey both into dentistry and then into endodontology?
So when I was 17, I was living in Singapore at the time, and I was studying in this junior college. And the course I was in was actually more focused for students who are going into medicine. And during my school holidays, I decided to look for a job without my parents' knowledge. And so I came across an advert on the newspaper where my orthodontist was actually looking for a dental assistant.
Yeah.
And so I rang up the clinic and I applied for the job and I got the job. And I went into work for about a month. And in this practice, there were, general dentists working there. There were even oral surgeons working there as well. And it gave me a lot of exposure during that time, during my school holidays to, what dentists do. And I enjoyed seeing the social interaction that, dentists have with their patients.
Yeah.
And also I found that the work was quite hands-on, which I, like because I've always liked arts and science. So it made me decide to apply for dentistry in the end. Yeah.
Oh, that's great. And then what about moving from general dentistry to endodontics? Was that something you realized early on you wanted to transition into, or did it just kind of fall into place?
No, actually, it took me quite a bit of time to find out what I wanted to do in my career path. I graduated in 2001, and then I did my primary exams with RCDS in 2003 because I just enjoyed learning more about the basic sciences, and I just wanted to take my knowledge, beyond what I knew at university.
Yeah, of course.
And I've, loved general dentistry, and I just thought it opened up a lot of doors to different areas that I could learn.
Yeah.
And in 2009, I was actually volunteering at the Victorian Institute of Forensic Medicine.
Yes.
And I, was, working and helping out in the mortuary. At the time, it just made me realize, how precious and how unpredictable life was.
Yeah.
And after volunteering for about 6 months, and my grandmother actually passed away, and
Okay.
I reached a point in my career where I just felt a little bit burnt out, and I was working 5 to 6 days a week for 5 years at the practice.
Yes.
And I just quit my job. And also at that time I was studying for the fellowship exams because I wanted to update myself on the literature that's, on, general dentistry.
Yeah, of course.
I wanted to also test if I could actually study again. So at that point in time, I found a new job, working part-time in a private practice in the city, where fortunately I was working with a group of specialists as well in different disciplines.
Okay.
And at the time, I, fortunately had these 3 endodontists working together with me, and
Yeah.
they allowed me to use the microscope. They allowed me to observe them plenty of times. And, after I spent lots of time with them, then I realized, okay, this is something that I could really enjoy doing because, first of all, I really like seeing pain patients because I like the detective work of it.
Yeah.
And secondly, I find that with endodontics is technically very challenging.
Yeah, definitely.
So because you're working in areas where you're relying a lot on your tactile sensation and you're relying a lot on your visual imagination. So to work in areas that you can't see is quite different to, say, for example, preparing a crown,
Yeah.
for a crown.
Yeah,
You can actually
definitely.
see what you're doing.
Yeah. Yeah.
So I, really enjoyed, the technical difficulty, I guess. And the third thing I really like was communication with the patients because often endodontists see a lot of challenging patients to
Yeah.
manage. And I'm generally a very calm person and I really like, talking to my patients a lot. So I guess for me, if I could, turn the patient from being angry and upset to someone who's really calm and happy with everything, then I think I really feel very rewarded by that.
Yeah.
So that probably, why it sort of drawn me towards endodontics.
Yes. Okay. Oh, that's great. And at the moment, you're also currently pursuing a PhD part time. What's the topic? What's the specific area of interest that you're pursuing within your PhD?
So the topic is on endodontic education in Australia.
Yeah.
And surprisingly, there hasn't been, much research on this area.
Yeah.
And in 2017, I went to this university in Amsterdam. And I met this professor who said to me, what, we are currently looking into endodontic education in Amsterdam. So is anybody doing that in Australia?
Yeah.
And I said to him, no, nobody really is doing that. And he said, why not? And I thought about his question, and I started researching about whether, people have looked into certain areas and I found a void
Okay.
in the knowledge base. So I thought this would be quite good to research into. And I've always enjoyed, teaching and the academic side of things. So I thought this would really suit me.
Kind of tying in your teaching, the teaching element with with your research and PhD there. I think it's always really nice to hear what else our guests are doing beyond just clinical dentistry as well. But what about outside dentistry altogether? What do you do to keep busy or to take a break from both your research and clinical practice?
I have a lot of hobbies, but I would say that, when I, usually work, I work in like an enclosed space. So I work in the room. And when I'm at home, I'm indoors as well. So I really like outdoor activities, which, I don't think a lot of people knew about until I started my Instagram account.
Yeah.
And so I love travel. So traveling to places where I can do hiking, mountaineering, and sea kayaking and scuba diving. So I try to do a lot of outdoor activities if I can.
Yeah. Okay. Oh, fantastic. So I bet you can't wait till we can go out again and hike to other areas as well.
Yeah, definitely. It's been quite hard with
Yeah.
this again lockdown, but I guess it's for a good reason. So
Yeah.
we just have to put up with it until we can get outdoors a bit more.
So when it comes to endodontics, what do you find that in general most dentists are struggling with when it comes to root canal treatments, say?
I think, first of all, what I've noticed is that a lot of general dentists struggle with the communication side of things.
Okay.
So, in terms of treatment planning, for example, if they decide to refer the patient to an endodontist for endodontic treatment, um, they may not have discussed yet with the patient about the restorative sort of plan
Yeah.
of
Okay.
that tooth.
Yeah.
And also the other thing that I found is if the treatment didn't go as planned, for example, if there was a fractured file or if there was a perforation, um, the patient may not be as well prepared about that complication or risk. So sometimes they will come to my room and then when during the consultation they'll be quite upset and say that either they were not aware of the risk or complication or they didn't know, the cost with proceeding with endodontic treatment with me as well, which, usually is cost more than what a general dentist would charge.
Yeah. Okay.
Yeah.
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 So you
Mm.
find it's first and foremost the communication aspect that general dentists seem to miss, at least at the start, kind of thing.
Yeah,
Yeah.
yeah. And I think that, it's good for maybe a general dentist to prepare a little consent form that sort of tells the patient about the level of difficulty with, endodontic treatment for a tooth.
Yeah.
And say that, okay, this is considered medium level difficulty or high level difficulty. If you're
Yeah.
happy for me to proceed, these are the complications and risks that can occur.
Yes.
But not just mentioning that, but also mention the patient that, if those complications and risks were to occur, then, this is what we'll have to do as the next step, refer you to a specialist to manage that. Or I guess the other alternative is for the patient to decide to see a specialist early on in the treatment process.
Yeah. Yeah. Okay. And in what ways then do you think dentists can improve their skills in these areas? Say, for example, even in communication, but also in these iatrogenic areas that occur. Do you have any recommendations for CPD courses or programs as such?
I don't really think that it's necessary to do a CPD course for discussing treatment planning and complications and risks. But I think what I found very helpful when I was a general dentist was to actually talk to other colleagues and see how they would actually talk to patients about those complications and risks.
Yeah.
Other colleagues that are more experienced than me, of course. And also, not to forget that, you could also talk to your specialists about how they will communicate those complications and risks, because they do that on a daily basis.
Yeah. Yeah.
Yeah. And I think, just trying to figure out what others would say, and also reading the patient really well as well. Like, for example, if I mention about instrument fracture, I usually, ask the patient, so I've discussed through the complications and risk with you. How do you feel about it? And
Yes.
sometimes you can see from their, facial expression,
Yeah. Of course.
might be looking like they're about to pass out talking about a fractured instrument.
Yes.
So I think you have to read the patient and then explain to them as well that with every dental procedure that you carry out, you always have to go through the complications and risks, even though they're very low in general.
Yeah. Yeah,
Hmm.
definitely. Okay. And what about when you compare like general dentists with students? What do you find students themselves are struggling within endodontic programs? What do they find the most difficult, would you say?
I think students are quite different from general dentists out there, because they are obviously thinking about getting through the course and trying to pick up some really basic skills, and communication may not always be something that they focus on at the beginning.
Yes.
And I think that, also the other issue too is most students are trained in a hospital or in a community dental clinic environment.
Yep.
So, they wouldn't have to discuss, complications and risks as much, or to discuss through the cost of treatment, and, the health funds, as much as compared to general dentists in a private practice. Also, they're protected in a certain way, in the sense that if they encounter a challenging patient, or if they encounter a difficult situation, they can always rely on the clinical demonstrator to come in to help them out.
Yeah. Yep.
Because if there was any complication that has happened, for example, a fractured instrument that has happened during the treatment process, they would usually get the demonstrator in to talk to the patient.
Yes.
So they wouldn't be sort of dealing directly with the patient themselves. So I think, so it's quite different in the sense that I guess the dental students are in a protected environment.
Yep.
And once they get out there, it's like a steep learning curve for, I think, all the new graduates.
It's good because students they're trying to learn at the same time, so they do need that extra, I guess, layer of protection, and having someone to bounce ideas off, even if it's just to have a conversation to put their mind at ease. So definitely a steep learning curve going from that to where it's just yourself and the patient in the room. I'd say so.
Mm. Yeah, and also, I guess the other thing I was going to mention was what I do with my students is that I try to have a briefing with them at the start of a clinical session and try to throw them some clinical scenarios that might be a little bit challenging to manage and see how they come up with different ideas to deal with that situation as well.
Yeah.
And I guess for, general dentists, most of them will be working in an environment where they're usually working with someone else or they're working for someone. So they have that always a level of support.
Yeah. Yeah.
And I guess with the students, sometimes as a demonstrator, because you are assessing them at the same time, they might feel also a little bit hesitant to ask you questions.
Yeah.
That's the other thing that I found.
Yes.
And I really have to make it very clear to them that at the briefing, it's not about assessing them. It's more about exploring how they think, about talking to patients, about managing a difficult situation. And by providing that sort of, I guess, supportive environment, I guess that helps the students to ask me more questions and learn more.
Yeah.
So I think, there's quite a bit of difference between what a student will struggle with compared to what a dentist will.
Now, obviously, when we're doing root canal treatment, radiography plays a huge role. It's definitely going through dental school. We take multiple radiographs to assess, our progress at different stages throughout the treatment. But now with the advent of 3D imaging and 3D radiography becoming, more available, are you routinely taking 3D scans of teeth for endodontic treatment, or are you still just most of the time just using 2D imaging?
I tend to use it probably less than 10% of the time, to be honest. And I would say that, for all endodontists out there, we are all learning about how it influences our diagnosis and treatment plan.
Yes.
And there's quite, quite a lot of differing opinions among even the endodontists themselves about how often they should be using CBCT as well. Yep. Some endodontists that I know in Melbourne would use it maybe 90% of the time.
Okay.
Patients. Some maybe even like me, less than 10% of the time. But the way I look at it is using CBCT a little bit like a GPS.
Yep.
So, when traditionally we were trained to use 2D radiographs and also to search for root canal, through internal inspection.
Yep.
And, we don't really need to use a CBCT scan to look for root canals as such.
Yeah.
And, some people might argue that by having a CBCT beforehand, it takes out the guesswork, and that, for example, there's this number of root canals in the tooth, and you can have a very conservative excess cavity as a reason for taking the CBCT. But I think that you still should be able, as an endodontist, if you're using a microscope, you should be able to be conservative anyway.
Yeah.
So I only apply the CBCT in situations which are unusual. So if I find that this is something that is out of the range and to what I would normally find, or if what I'm doing normally doesn't give me the answers that I need, then I may need more information from a CBCT. Then I would use it.
Okay, all right.
Yeah.
So it's more that second line. If you can't get everything you need and want from your microscope, visual, tactile, and 2D, then and only then do you proceed to CB. Okay.
Yeah, there are some scenarios that we may find that a CBCT could be quite useful. For example, if the tooth has external invasive cervical root resorption.
Yeah.
On a 2D radiograph, usually we can't see, the extent of it that well.
Yes.
Or the location of it. So having a CBCT just allows us to, I guess, treatment plan a bit better.
Yeah.
And to actually understand, how extensive it is. And then it also allows us to communicate better with the patient as well, because the patient can actually see the extent of the root resorption. Okay. So I guess, every endodontist that you speak to might have differing opinions on the use of CBCT. Yeah. But I still think that we need to stick with the ALARA principle
Yeah.
that we need to, be careful with its use, because sometimes, if you use it 90% of the time or more, you're exposing patients to more cost and radiation as well.
Yeah, and if you're able to, like in your case, if you're able to achieve the same result 90% of the time without it, then in following the Alara principle, it would make sense to minimize that.
Yeah, and there's a lot of research in this area actually where they look at how a CBCT would actually influence our decision making.
Yeah.
And what the current research found is that it really only impacts on the clinicians if they are managing really difficult cases or really unusual cases.
Okay.
So I think that also applies to what we do clinically as well.
Another area that's had a lot of advances recently is dental implantology, and a lot of the times, patients and a lot of general dentists are doing this more and more now as well. And patients are kind of walking into dental clinics and asking, "Oh, look, I could have this root canal and pay X amount of dollars, or I could just get an implant. Should I just get an implant?" It's quite a common phrase that patients will often say. What is your response when patients often come to you if they're at this point where they could spend this money on a root canal treatment, or spend this money on an implant? How do you kind of respond in that situation?
I would explain to patients that endodontic treatment or root canal treatment and implant therapy are really two different modalities of treatment options.
Yeah.
And with the tooth, with the natural tooth, once it's extracted, is gone forever.
Yeah.
And the other thing too, I've always mentioned to patients is that when we actually look at the success rate of, say, implant therapy versus the success rate of endodontic treatment. With implant therapy, we find that generally the success rate quoted is very high.
Yeah.
But that's usually because they only look at the survival of the implants.
Okay.
And, as we learn more and more about the mechanical and biological complications with implant therapy, then, we are actually looking at a higher risk of complications and risk with implant therapy than compared with endodontic treatment in general.
Yeah. Okay.
And I think the patients that, obviously patients that have really compromised teeth, and teeth that, say, for example, structurally quite compromised, I would say to them, if they really wish to explore the option of having extraction and, say, having an implant supported crown, I always say to them it's worthwhile to explore that option, and maybe with the dentist or with the periodontist or oral surgeon, and discuss the complications and risks with regards to the extraction process, with regards to the implant therapy process. And then, before coming back to me, if they're still wanting to proceed with the endodontic treatment.
Yeah.
Because if I do treat a patient with a really compromised tooth, they have to be on board with me. They have to understand that, the treatment option may not last.
Yeah. Yeah, definitely.
So, and, some patients are prepared to go through endodontic treatment and get a few years out of it.
Yeah.
And, some patients are not.
Mm.
So I guess, and the other thing too is we also have to assess each patient individually, because not every patient would actually want to have implant therapy or are suitable for it.
Yeah.
So I guess, when it comes to treatment planning, patient factors, costs, and, their wants, come into play. And I think it's, a bit more complicated than just, say, looking at the success rate of the treatment.
Yeah. Okay.
Mm.
So then a lot of the times when literature has stated that, the success rate of implants is X success rate, a lot of times you're saying they're really only referring to the implant staying in the bone.
Yeah, definitely. So, there has been clinical study looking at, thousands of, teeth that have been endodontically treated versus, say, an implant supported crown, and looking at the survival of, between these two modalities. And they found that it was about the same over a long
Okay.
period of time, over, say, a 10-year period. So survival of, endodontically treated teeth and implant supported crowns probably is about the same. But I think for the patients to make a better decision in moving forward with either treatment options, they really have to think through the complications and risks with regards to each option, think through the costs, and think through what they want. Sometimes I even say to the patient, so if you have this tooth treated with me and it's quite a compromised tooth, and if the tooth sort of need to be extracted within, say, the next 5 years, how do you feel about it?
Yeah. Okay. Oh, yeah, that's a good.
So that I get a sense of how they feel about, say, going through the endodontic treatment and then having to extract it down the track.
Yeah.
And when I pose this question, often patients then reflect upon what they really want for themselves. Yeah.
Yeah, I think that's a really good way, because it's kind of putting the ownership back on the patient to make the choice at the end of the day, since they're the one receiving the treatment and the one paying for it too. So I think that, yeah, it's actually a really good approach. So Aovana, for any of our listeners who are wanting to specialize in endodontics or thinking about it, what would be your advice to them in terms of next steps and planning to actually pursue that career in endodontics?
I think the first step is really to do your research well on the postgraduate program.
Yeah.
And also about the career path that you're going to take. So when I was a general dentist, I spent quite a bit of time with the postgraduate students and just talking to them about what they think about the program, and also understanding their struggles.
Yeah.
And I was also really close to two endodontists that I was working with at the time. So they actually gave me an insight to the struggles that an endodontist would have to deal with. For example, one of the endodontists I knew at the time told me that, she really had a very hard time finding a job.
Okay.
And if you think about how difficult it is for a dentist to find a good job,
Yeah.
it actually becomes even harder for a specialist.
Right. Okay.
Because you have a narrower, sort of pool of practices to work in.
Yeah.
I think by understanding the struggles of the postgraduate student and an endodontist, that will give you a more realistic insight into the work that you do.
Yeah.
And I guess the second point is that you have to think about whether you are prepared to give up, some areas of general dentistry. For example, how do you feel about never extracting a tooth again? And how do you feel about, never doing a crown preparation in your life again?
Yeah.
So I think you have to be mentally prepared for that, and just focus in a field that you're passionate about.
Yeah.
The third point I'll say is you need to save up and be well planned financially.
Yeah.
Because it's not just the cost of the course that you have to put in, it's also that you won't be actually able to work in that 3-year full-time period when you're in the course.
Yeah.
So your savings is going to dip down, and you have to really be, I think, well prepared for that. Otherwise, it can become quite stressful. And I think the last advice I'll give is that you need to have a good chat with your loved ones as well, because you're going to spend a lot of time on your course, and you're going to be maybe away from your family sometimes,
Yeah.
and not being able to take part in the social interaction as you normally would with your friends, for example. So you kind of have to be prepared for that and think about the impacts that you might have on your family or your friends.
Yeah. Okay. No, I think it's really important things to consider, given it is such a big commitment over 3 years, and no doubt it is worth it at the end. I'm sure everyone feels that way, but as you said, there's a few things definitely to consider if someone, I guess, for any specialty as well, that they're considering to pursue. Is there any aspect of general dentistry that you miss besides root canal therapy?
Um, Actually, I enjoy endodontics so much at the moment that I don't actually miss general dentistry at the moment.
Oh, great. Well, you chose the right specialty then.
Yeah, I think I did. I
Yeah.
did.
Look, just to finish up, Ivana, for any of our for all of our listeners out there, is there any major lessons or key piece of advice or pearls of wisdom that you heard early on in your career that you still carry with you today in your clinical practice?
So when I was an endodontic postgrad, I've encountered a really lovely endodontist who told me that every 5 years in his career he's going to reinvent himself and expand his horizons in his knowledge.
Yeah,
And I thought about what he said, and I think, why not apply it to what you do every day? And, I reckon, in life, every patient that you meet is going to be a learning experience.
yeah,
So, why not really make full use of that opportunity and see it as a chance for you to improve? For example, if you do a restoration, then think about, okay, I'm going to do a better restoration this time than the one I did yesterday.
yeah, yeah,
So I try to think about, what I do in the clinics that way and constantly reflect upon my work, every day and think, I've done it this way this time. Why don't I try doing this another way?
yeah. Okay.
Or, why don't I think about, exploring more options with my treatment options? And for example, as a general dentist, I used to contact the specialist I was referring to a lot. And I would actually spend a bit of time discussing how they would communicate with the patient, for example, in that situation, and also how they were going to manage the patient. So I think, by sort of exploring the options and communicating with more other like clinicians and specialists, for example, that's going to be an extension of your care for your patient.
Yeah,
So I think there's should be continuous growth as a clinician, not
yeah,
just, focus on reinventing yourself every 5 years and
yeah,
stay stagnant for that 5 years.
yeah.
Mm.
Okay. Oh, it's fantastic. Yeah, definitely good piece of advice there for all of our listeners, young or old. Look, Ivana, thank you so much for coming on the show today. I definitely got a lot out of it, and I'm sure our listeners did as well. So, thank you so much for taking time out of your schedule, and I look forward to chatting with you again sometime.
No worries. And it was a pleasure to help you out with this program. Thank you.
Thanks very much, Ivana.